A doctor on the front lines is sharing what it's like to care for COVID patients every day, again, after he hoped the end of the pandemic was near. He spoke with our Erica Ferrando to bring us his story.
It's bad. It's bad.
As a critical care physician on the Westbank, Dr. Jay Miller is used to caring for patients with common emergencies like heart attacks, car crashes, or post-op cases in the ICU. But right now, he's seeing double or triple as many patients on any given day, and they're all COVID.
All those other illnesses and routine things that happen to people in the community aren't in the ICU because there's not room in the ICU for those patients.
Hospitals are redirecting staff from some departments to care for the influx of COVID patients.
Our surgical wing is completely filled with COVID.
It's putting non-emergency surgeries on hold.
There's some patients who have had some masses, suspicious growths in their lungs that need to be biopsied. Those sort of procedures are unable to be performed at this time due to the lack of beds.
Dr. Miller has been on the other side. At the start of the pandemic in April 2020, he spent a week in ICU at UMC battling COVID-19.
Walking out of UMC live.
Going through COVID and being in an ICU bed and writing my wife a goodbye letter while I was in the ICU compared to getting a shot in my arm is it's silly to even think that there's anybody who wouldn't opt for the latter.
Currently, 91% of patients hospitalized with COVID in Louisiana are not vaccinated.
For anyone who thinks it's just about them, and it's just about their own rights to get a vaccine or to not get a vaccine, I urge you to think about the grandmothers falling and not being able to have a hospital bed for them.
As Dr. Miller cares for COVID patients every day, he worries for his family, his 10-month-old daughter, who is too young to get vaccinated.
I live in constant fear that I'm going to bring this home and give it to her, which I don't know how I'd live with myself if that happened.
He's left with a feeling of uncertainty. How long will this fourth surge last? And how much more can healthcare workers take?
It's tough, but I go to work every day and I try to smile, but it's getting harder and harder.
Erica Ferrando, Eyewitness News.
Currently, there are just over 2,900 people hospitalized with COVID in the state. That is the highest ever.